after a large meal, most people feel sleepy. This is called food coma, but that's actually the mildest effect you get from eating too much at once, because overeating increases heart attack risk by up to 4 times. Also, a large meal can trigger heartburn, gallbladder issues, and even shortness of breath. And here's an important question. Can a single episode of overeating cause permanent damage to your body? Or how does regular overeating affect your brain and body? Or can overeating actually shorten your lifespan? That's what I'll tell you. Every detail you need to know about overeating and your health. If you ask what overeating really means, one-time overeating is when you feel full and uncomfortable after just one meal. But in everyday life, overeating means eating so much that you feel discomfort or even pain after meals. Chronic overeating means a person regularly eats more than the body actually needs to function. When you eat a large meal, your stomach stretches. This increases the pressure inside your stomach. It opens up the valve between the stomach and esophagus. Acid from the stomach splashes back into the esophagus. That's why you feel heartburn or a burning sensation. At the same time, blood is redirected to the digestive system. About 40% more blood goes to the stomach and intestines, which means less blood is available for the brain and muscles. So you feel tired or sluggish. Another thing, after a large meal, your insulin goes up, sometimes up to 5 times higher. This increases serotonin and melatonin in your brain, so you feel relaxed and sleepy. This is why that food coma feeling is strongest in the first 2 hours after a big meal. Most people feel this urge to nap about 30 minutes after eating too much. Most people start to feel uncomfortably full after eating about 500 grams of food or drink in one meal. And this blood redirection to your gut also causes your blood pressure to drop. About 1 out of 3 people feel lightheaded or dizzy after a heavy meal. Usually blood pressure falls by 10 to 20 millimeters of mercury. But in older adults with high blood pressure or diabetes, the drop can be much stronger, some even faint. The next big risk, when you eat a large meal, heart blood flow drops. In healthy arteries, the heart can adjust, but if your arteries are narrowed or blocked, your heart may not get enough oxygen. The heart is also working harder to digest. Demand for oxygen goes up, but supply is limited. This combination can trigger chest pain, angina, or even a heart attack. Heavy meals increase the risk of heart attack by about 4 times in people with existing heart or blood vessel problems. About 10 to 15% of all heart attacks are triggered by a large meal. The highest risk is in adults over 50, especially those with risk factors like hypertension, diabetes, obesity, or previous heart attack. The risk peaks in the first 2 hours after the meal. Symptoms include chest pain, heaviness, discomfort, or pain spreading to the arm or jaw. Usually starts within 1 hour of heavy eating. There's another effect. The stomach expands and pushes against the diaphragm, your main breathing muscle. If your stomach is too full, it pushes the diaphragm upwards so your lungs can't fully inflate. You start to feel short of breath.
This is especially noticeable in people who are overweight, have a large abdomen, or have lung problems. Also, overeating worsens asthma in about 80% of cases, mainly because of acid reflux. If you constantly overeat, your stomach can adapt by stretching and increasing its capacity. Chronic overeaters can have a stomach that holds 1.5 to 2 times more food than people who eat small, regular meals. But the stomach is muscular, so it can shrink again if you start eating smaller portions over time. True permanent enlargement is rare. Chronic overeating alone does not directly cause stomach cancer, but it does raise risk if combined with things like processed meats, preserved foods, or obesity. Obesity increases the risk of stomach cancer by up to 50%. If someone has chronic reflux from overeating, the risk of esophageal cancer goes up several times. When we talk about overeating, it usually means eating more than 700 grams in a single meal. In calories, normal is up to 700 calories in one meal. More than 800 calories is already considered overeating. To put it simply, if you eat about 4 McDonald's classic burgers at once, that's overeating. Now, let's talk about permanent effects. For a healthy person, a single episode of overeating almost never causes permanent damage. Exception: in people with pre-existing heart disease, a single large meal can trigger a heart attack or dangerous heart rhythm. That can cause permanent heart damage or even death. Chronic overeating brings long-term problems like obesity and weight gain.
Over 80% of people who chronically overeat become overweight or obese within a few years. Metabolic problems increase. Type 2 diabetes risk rises 2 to 4 times, and high blood pressure risk increases by 30 to 50%. Fatty liver disease develops in up to 40% of chronic overeaters. Even the brain is affected. Overeating high sugar or high fat foods impairs memory and doubles the risk of depression and anxiety compared to people who eat normally. Addiction risk also rises. Repeated overeating activates the brain's reward pathway, making it harder to stop eating, almost like an addiction. And yes, overeating can even shorten your lifespan. Chronic overeating that leads to obesity is linked to a 5 to 10-year reduction in life expectancy.
So remember, the next time you reach for that extra plate, it's not just about feeling full. It's about your heart, your brain, your future. Overeating may bring a moment of pleasure, but it can steal years from your life. The real victory comes when you listen to your body and give it just what it needs